Hello everybody, this is Dr. O, your deficiency-free survey coach. We are here today to discuss testing for COVID-19 in nursing homes. Apparently there has been a lot of confusion on who to test, when to test, how to test, where to test. So I just need to put a little bit clarity on some of the questions that I've been receiving. First of all, the testing requires you testing the residents, the staffs, and the contractors. You have to test everybody. So after you test everybody, the first phase, you don't have to test the residents again unless if they show signs and symptoms of COVID-19. There's no mandate that requires you to test residents on a weekly basis. For staff members, you test them every single week until 14 days without signs and symptoms of COVID-19. Again, for staff members, you test them every week until 14 days without any signs and symptoms of COVID-19. So that means that your staff has to be tested every week until there is no more signs and symptoms of COVID-19 for 14 days. For your contractors who come to your building, I know that was an issue because people were asking, which contractor, how do I test them, where do I contact them, when do I know they're coming in my building? Now, according to this mandate, contractors are defined as people who have frequent presence in your building. Those who have regular presence in your facility are your contractors. For example, your nurse practitioners, your hospice CNAs who are coming in every day, sitting for your hospice patients. Those are your contractors that request the testing on a weekly basis. Your nurse practitioners who comes in 2 or 3 days a week in your building. Now, some people were saying that it's the responsibility of the people they work for to do the testing. Now, mind you that if state comes in your building and there is a nurse practitioner there who has not been tested, it's not the people who employ the nurse practitioner that is getting deficiency, it will be you. And a little way they made it a little bit easier for us is that your COVID-19 testing can travel with you. That means if those contractors have already had COVID-19 testing that week, they can bring it. You can see it. So you don't need to do it again. Your agency nurses, you can ask them to bring the test they did. But you have to make sure that it's current because this has to be done on weekly basis. But for your staff, of course, you have to keep track of, when the testing is done, how you're monitoring them. So testing is very important to reopening of the nursing homes. Please make sure you're doing it right. Your residents, your staff, and your contractors. Contractors are those who have a frequent presence in your facility. Those are your contractors. Not everybody that works in your building you have to test. Absolutely not. Alright? I hope this video helps you to clarify the testing process in nursing homes. Please don't forget to give us thumbs up if you enjoyed it. And don't forget to visit us at www.deficiencyfreesurvey.com. See you next time.